Virtually anything that can affect the brain can cause a seizure. Having a seizure is an extremely common event. Approximately 1 in 10 of us will experience a seizure at some time during our lifetime. About half of that population, or about 5%, occurs in the setting of a child who has a fever, a sudden rise in their temperature, and they'll have a convulsion, so-called febrile seizure. That is not epilepsy. It's provoked. But that's just, an example of how the brain, if stressed enough, can have an epileptic seizure. The most common cause across all the ages for epilepsy is, we don't know. The percentage as a cause varies by time. So obviously as you get older, you have more opportunities to injure your brain, strokes, head injuries, and so on. Those become more prevalent. But the most common cause, even in the elderly, is that we do not have an answer. Well, if you think you may be having seizures, probably the first place is to talk with your primary care physician, because as I mentioned earlier, there are a number of medical conditions that can cause events that look like epileptic seizures or that are epileptic seizures. So for example, somebody who has diabetes, if their blood sugar drops too low, they can have a seizure. So the first place to stop is to talk with your primary care who knows your basic medical condition, other illnesses, family history, and so on. If the primary care physician feels that the events that you're describing, your family is describing, are suggestive of epileptic seizures, the next person, next person to be seen would be a neurologist. A neurologist is trained in epilepsy and brain disorders and can give a better assessment as to the nature of the events, as to whether or not they're epileptic or not. Because most of the time the physical examination doesn't reveal a whole lot, but a good history gives us the information that we need, and it can be supplemented then with tests such as an EEG, electroencephalogram, or brainwave tests, where we put electrodes on the patient's head and record their brainwaves, hopefully both during awake and sleep periods, looking for abnormal signals that are associated with epilepsy. We'll also can do neuroimaging, typically an MRI scan. We're looking for a structural, an anatomic marker that would suggest that somebody has an underlying brain condition that could cause seizures. Other than flying a plane, being a maritime skipper, or driving an 18-wheeler across state boundaries, your occupational or vocational expectations are not limited. Obviously, some common sense needs to enter in. I would prefer a patient with epilepsy, especially when the seizures are not completely controlled, not to be skydiving, parachuting, hang gliding, climbing, cliff climbing, scuba diving, and so on. But it's a sliding scale. The rule here is a sliding scale one, that if somebody's seizures are controlled, and have been controlled for some time, the expectations will continue to be controlled, and you can lighten up on the restrictions, as it were. The role medications play is obviously a major one. Unfortunately, only about 2/3 of patients with epilepsy can have their seizures completely controlled with medication, which means that roughly around 1/3 of the patients will continue to have seizures despite treatment. And it's that third that many of us have dedicated our lives. Those are the patients with recurrent seizures whose lives are can be completely disrupted, will have more difficulties holding down jobs, require multiple medications, multiple medication trials. Those patients that we consider possible candidates for surgery or experimental drug studies or for experimental programs, including implanted stimulators. Well, epilepsy is one of those conditions that has been known since early man. There are writings in Sumeria, there are writings in ancient Greece describing seizures and the seizure events themselves and implications, and even actually attributing it to the brain, which is even more astounding since we weren't sure, what the brain's function was. Hippocrates talked about seizure disorders and also talked about depression and melancholia and the interaction between those two. So it's been known for a very long time. Unfortunately, there have also been periods of time where people with epilepsy were thought to be possessed. I had a young gal who had on her very first date, had her very first seizure, and the boyfriend, thought that she was possessed, and she became ostracized at school. Jeanne d'Arc, is thought to have had epilepsy, and she would get visions as part of her religious fervor. We are not a terribly enlightened population, and even to this day, patients with epilepsy are not treated as well as they should be. And certainly, patients I talk with, they would be much more willing to accept a diagnosis that they had a small heart attack than they have epilepsy, or that they've had a small stroke, or that they have diabetes, or a number of other medical conditions, rather than having epilepsy. And yet, in reality, those other conditions can be more life-threatening and more intrusive and have a greater morbidity than the epilepsy itself.